NCLEX-RN Flashcards 2026 quiz to improve retention and recall speed. Question 1. A child has a puncture wound and suspected osteomyelitis. Which action is done immediately before the antibiotic is started? Option A. The admission orders are written. Option B. A blood culture is drawn. Option C. A CBC with differential is drawn. Option D. The parents arrive. The correct answer is option B. A blood culture is drawn. Cultures must always be obtained before the first dose of antibiotics is administered to ensure accurate identification of the pathogen. Question 2. A 2-year-old child refuses to walk and has a swollen leg. Which does the nurse suspect? Option A. Possible fracture of the tibia. Option B. A bruising of the gastrocnemius. Option C. Possible fracture of the radius. Option D. No anatomic injury. The correct answer is option A. Possible fracture of the tibia. Swelling and refusal to bear weight in a toddler's leg are classic indicators of a toddler's fracture or tibial fracture. Question 3. Which information should the nurse provide to the parents of a child with cerebral palsy? Option A. Irregular screening is important for secondary delays. Option B. CP is caused by injury to upper motor neurons. Option C. Milestones will require no intervention. Option D. Outdoor activities are prohibited. The correct answer is option B. CP is caused by injury to upper motor neurons. Cerebral palsy is a motor dysfunction disorder resulting from permanent, non-progressive damage to the upper motor neurons. Question 4. Which statement about Duchenne's muscular dystrophy is most accurate? Option A. Daughters have 50% chance as carriers, sons 50% chance of disease. Option B. Both have a 50% chance of developing the disease. Option C. Each child has a 25% chance of developing it. Option D. Sons only have a 25% chance of developing it. The correct answer is option A. Daughters have 50% chance as carriers, sons 50% chance of disease. Duchenne's is an X-linked recessive disorder. A carrier mother has a 50% chance of passing the affected X to her son's disease or daughter's carrier. Question 5. Mrs. Chua, a 78-year-old client, is admitted with the diagnosis of mild chronic heart failure. Which lung sound does the nurse expect to hear? Option A. A stridor. Option B. Crackles. Option C. Wheezes. Option D. A friction rubs. The correct answer is option B. Crackles. Crackles, rals, are the classic breath sound associated with heart failure, caused by fluid in the small airways and alveoli. Question 6. Patrick, hospitalized following a myocardial infarction, asks why he is taking morphine. The nurse explains that morphine. Option A. Decreases anxiety and restlessness. Option B. Prevents shock and relieves pain. Option C. Dilates coronary blood vessels. Option D. Helps prevent fibrillation. The correct answer is option B. Prevents shock and relieves pain. Morphine is the drug of choice in knee because it relieves severe pain, reduces anxiety, decreasing sympathetic workload, and reduces preload/afterload. Question 7. Which of the following should the nurse teach the client about the signs of digitalis toxicity? Option A. Increased appetite. Option B. Elevated blood pressure. Option C. Skin rash over the chest and back. Option D. Visual disturbances such as seeing yellow spots. The correct answer is option D. Visual disturbances such as seeing yellow spots. Digitalis, digoxin, toxicity commonly presents as gastrointestinal distress and visual changes, particularly yellow-green halos or spots. Question 8. Nurse Tricia teaches a client with heart failure to take oral furosemide in the morning. The reason for this is to help. Option A. Retard rapid drug absorption. Option B. Excrete excessive fluids accumulated at night. Option C. Prevent sleep disturbances during the night. Option D. Prevention of electrolyte imbalance. The correct answer is option C. Prevent sleep disturbances during the night. Taking diuretics in the morning prevents nocturia, frequent nighttime urination, which would otherwise disturb the client's sleep.